David Barker developed the fetal origins hypothesis. And basically, what he pointed out to us is the science that shows that the impact of fetal life has on the health of that individual throughout his or her entire life. So whether or not there's autism at a very young age, or ADHD at a slightly older age, or diabetes, or high blood pressure, or Parkinson's, or cancer. All of this is impacted in part by the experience in the uterus. So we better think about that experience. And the CDC basically shows us that 1 in 68 children in the United States is now diagnosed with autism. And you can argue, well, are we overdiagnosing? Are we diagnosing more liberally? And many people believe that we are, and yet everybody agrees there's also more autism. We also know there's about 3 in 100 birth defects of various kinds in children in the US. So can we change that? And I would argue that we can. That there are things that we could do if we're smart and we know the science that can reduce the likelihood of an autism diagnosis in one of our own children or a child that we're caring for. So first of all, if you take folic acid, preconception, and in the first trimester, there's a 40% lower association. So we don't have randomized controlled trials, we have epidemiological trials, but they're very large, and there have been 3 separate ones, all of which show about this 40% reduced rate of autism. SSRIs, if you are on an SSRI for the year before you conceive, twice the likelihood of autism. If you're on SSRI your first 3 months of pregnancy, 3 times the risk of autism. I'm not anti-pharmaceutical medicine. I think it has a role. But how many women are told, well, why don't you just stay on that so that it doesn't come back? Or, you have, a little bit of depression, let's put you on an antidepressant. And potentially it could have been managed in many, many other ways. So I think we prescribe these very liberally, and if women knew the potential risks, which aren't necessarily discussed, they may make different decisions. Remember that half of pregnancies in the US are unplanned. Seizure medication, valproic acid, increases the risk of autism. We have other choices if we're taking care of a woman of childbearing age. Air pollution. We think that other environmental chemicals, the data is not as strong. Of course, we're never going to do a randomized trial where we expose women intentionally to environmental chemicals, and advanced paternal age. So what would the integrative approaches be? These are the things that we're going to cover, and we're going to cover them quickly because it's a short amount of time that I've been given to speak, but you have detail in your handout, and you also have the references. So does diet matter? Who here thinks diet matters? Okay, we're at a restorative medicine conference, so, yes, diet matters. Let me show you the data. The Mediterranean diet has been studied. This is a case control study where 485 women who were having difficulty conceiving were age matched to 1,600 controls who had already had a child. And basically there was 44% less difficulty conceiving if women ate a Mediterranean-style diet. Even in the setting of in vitro fertilization, where you're completely taking over the hormonal messages to the body, there was a 40% increased probability of pregnancy when couples followed a Mediterranean-style diet, so the men and the women. And when they looked, they found that there was higher red blood cell folate, more B6, and more follicular fluid, making IVF more likely to be successful. The Nurses' Health Study, too, has looked extensively at a variety of factors that connect both specific nutrients, macronutrients, and fertility, and I'm going to review those for you. So, as you know, this study has been going on for almost 30 years now, 116,000 nurses, and they started measuring diet in 1991. Of the various women, 438 women reported ovulatory infertility. So first of all, carbohydrates. Your total carb intake, not related. However, total carb doesn't help you that much, as we know, because there's a big difference between eating something that's a dense carbohydrate or eating a piece of white bread. So as it turned out, the white bread, the white potato, the white rice, the high glycemic index foods had almost a double relative risk of ovulatory infertility, whereas the low glycemic index foods were low risk. And the one food category that stood out were breakfast cereals. Now, when you go to the store and you walk down that aisle of breakfast cereals, what does it say on the label? American Heart Association, right? High fiber. So how are our patients supposed to know that this is actually an unhealthy food choice with lots of flour and sugar that's going to increase their risk of all sorts of things, including potentially infertility? Soda as well. Other studies, not the Nurses' Health Study, have shown that soda consumption also increases the risk of infertility. And this is the physiological mechanism. So you eat that high glycemic index food, high glycemic load, and you increase your insulin. Insulin, when it's elevated, reduces sex hormone binding globulin. And we know that while sex hormone binding globulin binds to all hormones, it has a preference for testosterone. So if there's less sex hormone binding globulin circulating in your body, then you're going to have more free testosterone, which creates a PCOS-like situation. And in that PCOS-like situation, you are going to have more ovulatory infertility. What about protein? Well, it turns out that the type of protein you eat, again, it's not good for us to just make these sweeping global carbs are good, protein's bad. We really have to dive deeper into the specifics. So when you look at protein and ovulatory infertility, it turns out that animal protein increases the risk by about 40%. If you're consuming vegetable protein instead, you have about a 22% reduced risk. And this is especially important in women over the age of 32. So when you're very young, you are very fertile typically. And as you age, these various factors that we're going to talk about may become more significant in terms of predicting whether or not someone will be successful or unsuccessful in conceiving. Also, just to say that fish, eggs, people often ask these questions, have a neutral effect, and that soy protein, because people often say, well, soy is a phytoestrogen. Is it going to help me or is it going to interfere? And it looks like soy is both safe and actually, from more recent study, appears to enhance fertility in women. So fish, let's talk about fish for a minute. This year, the FDA and EPA finally put out new guidelines. And they're pretty consistent with the past in that they say don't eat shark, swordfish, king mackerel, or tilefish because they have a lot of mercury, a lot of PCBs. That was out there before. Eat 8 to 12. This is the positive message that they're stressing, that you should eat 8 to 12 ounces of fish that are lower in mercury. And we have to recognize what happened when the earlier EPA warning came out. Women stopped eating fish entirely. And why do you have to eat fish? For your omega-3s. Omega-3, choline, iodine. It's a very rich source of nutrition for some of the nutrients we really want for women to have in their body before they try to conceive. Another interesting little lobbying, and again, remember, I want you to be advocates for change. Who here eats tilefish? Raise your hand if you've ever eaten tilefish. Apparently gets served sometimes in the South, but I see one hand up. That's it. Why isn't tuna up there? Well, because the tuna lobby was successful in lobbying the government to be number 5 instead of number 4, which they should have been, because everybody, I shouldn't say everybody, who here has eaten tuna fish? I mean, look, that's a lot of hands. So it's always interesting to notice how do we get our public health recommendations and how much are they influenced by industry. Fish has been studied, and this is research that is done by Joseph Hibbelin, who's at the NIH, and he's an omega-3 researcher. This was research he did in the United Kingdom, looking at almost 12,000 pregnant women. And when they looked at maternal seafood intake, the women who ate less than 340 grams, of course, UK, so we've got grams, that's about 12 ounces, had children with lower verbal IQs. So you need that fish for the omega-3s, but also potentially for the iodine. I'm going to show you that research soon. And I also want to remind you, this counts for our sushi too, and I know this is a busy slide, but the same 4 fish go by different names. We have kajiki and we have saba. We don't always call the fish by the same names. And so I like to point the women in my practice to this handout by the National Research Defense Council so that when they're out, they can also look at, well, what about sushi? So the message here is that we're not so good at complex public health messages. We want the people we take care of to eat smaller fish that mostly feed on plants, on algae, so that they have less bioaccumulation of mercury and PCBs. We want them to eat fish that are rich in omega-3s, and there are many resources that can help women choose these fish. All right, let's go on to micronutrients. Who has seen headlines that say, your multivitamin can kill you? Raise your hand. It's a big anti-vitamin media message in this country. There's one place that everybody agrees. Everybody, all of the major associations, the American Academy of Family Physicians, the American Academy of Pediatrics, the American College of Obstetrics and Gynecology, and the United States Preventive Services Task Force, they all agree that women of childbearing age should be taking folic acid, and often they language it as a multi-nutrient that includes folic acid. So in that group of women, there's very good evidence. As I said, half of pregnancy is unplanned, and so we want women of childbearing age to be taking these multivitamins, multiminerals. This is why. The Nurses' Health Study shows 41% lower risk of infertility if you're taking a prenatal. There's fewer miscarriages. Miscarriages are devastating. That's a 2016 study, so that's not the Nurses' Health Study. There are fewer birth defects when women take these multi-nutrients, fewer neural tube defects, we know about that, but also less cleft palate, less heart defects. Very good evidence to show that. Once your baby's born, there's less pediatric cancer if your mother took a multivitamin while she was pregnant with you. And I showed you earlier that association with less autism. So this is from the Nurses' Health Study, and essentially you can see that if women took their multi-nutrient 6 times a week, 41% reduced risk of having this ovulatory infertility. And the reasons that it helps with embryogenesis and it helps with implantation. But, you know, we also have this message out there, well, women should just eat a healthy diet, right? Just encourage everyone to eat a healthy diet. Who's going to disagree with that? Of course we should encourage the women we care for, the men we care for to eat a healthy diet. But look here, is that showing up, the pointer? No, it doesn't show up. Okay, you could probably see pretty well that when you look at vitamin D, vitamin E, vitamin B12, choline, potassium, you have upwards of 80% of young women not getting enough in their diet. So it's all well and good to say everyone should eat a healthy diet, but this is the reality that we have in our country from the CDC. People are not getting all of the nutrients they need from their diet. And they're also not taking supplements. More NHANES data, 34% of women between the ages of 20 and 39 get the recommended folic acid. So we're not doing a very good job with 2/3 of women not getting the recommended prenatal vitamins. All right, let's go to a patient. Let's describe a patient. This is a woman I saw relatively recently in my clinic. She's 34 years old. She's been married for a year, and she wants to conceive. She's really takes very good care of herself. She exercises. She eats a mostly organic diet. And for years, she's been told that she has this, a slightly elevated TSH. She says she has no symptoms, and she's very naturally oriented and didn't want to be on any medicine. When I probed more closely, I did hear that she's got some cold intolerance, she's got some constipation, her periods are on the long side, she's tired, she feels like she's more tired than her husband, and her nails break easily. So I would say she actually does have symptoms of hypothyroidism once you ask her some more questions. So what would you do? I'm just going to give you a minute to think about it. If we had more time, we would really dissect it as a group. But just think for a minute, what would you do in your practice? And I'm going to tell you what happened with her. Okay, so she saw a naturopathic doctor who tested her urinary iodine and was found to be low. Now what would you do? What would you do in your practice if you had a woman who had low iodine and subclinical hypothyroidism. Well, this is what the naturopathic doctor did. He treated her with Lugol's iodine, and her TSH went up to 6. So now most people would agree, yes, she is hypothyroid. She was upset about this. She went to see her primary care doctor, who put her on a low dose of thyroid. She was agreeable, and her TSH went back to 3.2. And then she saw an endocrinologist who said it's going to take time to correct that iodine, and you don't actually need thyroid. It's okay. You know, you're sort of in an okay range, until he heard that she wanted to have a baby. And then he said, and this was a direct quote, "Babies like the TSH to be 1." And I would say, in my experience, when women are having trouble conceiving, I often find, get the TSH close to 1. Don't overtreat, of course, but if someone's at a TSH of 2.5, put them on a little bit of thyroid, get them close to 1, and it is amazing that one intervention, relatively simple, often helps women conceive. But in her case, she's now been on this 0.025 for 8 weeks. She said, when she came back and saw me, well, I wasn't really taking it right at first, because she was a morning exerciser and she liked to have coffee with milk, and so she felt like she wasn't taking it on an empty stomach. And so she was like, well, maybe I wasn't doing it right. And she also had still been taking her prenatal, which had iodine in it, so she felt like she was still getting some iodine. However, you could see some improvement. Her periods had shortened, her constipation and energy were better, and so were her nails. So she told me she had started trying to conceive, and I actually suggested, well, maybe you just wait a little bit longer, because I like people's thyroid to be normal. What's one of the leading causes of mental retardation worldwide? Hypothyroidism. And I mean, maybe not this degree, but again, we want people to be in optimal health before they conceive. So I spoke with her, this was about a month ago, and we had put her on a higher dose, and her TSH still hasn't budged. I'm going to take questions at the end. Yeah. I think this is an interesting point, and the reference on this basically says that if you treat people with high doses of iodine, you can throw them into true hypothyroidism. So I think we have to be careful. We definitely want to recommend iodine if someone has low iodine, but we want to be careful about the dosing of how much is safe to use. And in her case, the next step would be to put her on a full therapeutic dose of thyroid based on her ideal BMI. Iodine insufficiency is common. It's more common in the UK, where they don't iodize salt. And this is more work by Joseph Hibbelin, who basically showed that a lot of women were mild to moderately iodine deficient, and the women who were in that iodine deficient state, again, had lower verbal IQs, more trouble with reading accuracy, and more trouble with reading comprehension. So even though we would think that iodine insufficiency would be gone from our countries once we, as Western societies, iodize salt, a lot of people avoid iodized salt. They do sea salt, which mostly isn't iodized, although you could now get that. They eat processed food. Processed food has a lot of salt, but it's not iodized salt. We may have things that interfere with iodine in terms of some of the environmental chemicals that we're exposed to. So the World Health Organization, the Institute of Medicine, both recommend that we do supplement women who are trying to conceive with iodine, but I would say about half of the prenatal vitamins out there do not have iodine in them. So when you're seeing someone who's on that vitamin, ask them to bring it in, look at the label, be sure that there's an appropriate amount of iodine in the multivitamin. And I would be cautious about supplementing by saying, well, just eat your kelp or eat your seaweed or get it in these other ways, because the therapeutic window for iodine is relatively narrow. As we could see from my patient, you can also overdose someone and shut down their thyroid in that way. Another important micronutrient is iron, and iron is often insufficient in women, and so you really want to be sure that women are taking a supplement. Supplemental iron turns out to be more effective than iron in red meat, for example, in terms of its absorption. So look at that multivitamin and make sure that there's a small amount of iron as well. And this is in your handout, but if you're looking at someone's prenatal multivitamin, you want to be sure that these are the amounts of the various multinutrients that are in it. What about probiotics? Who here recommends probiotics to women who are trying to conceive? Okay, a bunch of you. You know, there's not actually studies in preconception. I'm trying to show you the evidence for everything that we have it. We don't actually have studies looking at probiotics in terms of will they help. I certainly use them, especially if women have been on many antibiotics, if they tell me about GI tract symptoms that I think would be helped by a probiotic. But we don't necessarily have evidence that they're going to help with conception. We do, however, have evidence that taking them in the last trimester of pregnancy reduces the risk of asthma and eczema. And a brand new study that was just published a couple of months ago looked at the use of Lactobacillus plantarum in India and found that the rate of sepsis was reduced by 40% by giving babies probiotics after birth. That's a really important public health intervention. I mean, sepsis in a baby is pretty terrible, and that you could reduce it by this amount with something as simple as a probiotic is something we want to keep in mind. Chasteberry, who's using Chasteberry with women who are trying to conceive? So long-standing, commonly used herb in women's health. There are two studies. They're both relatively old studies, but in both of them you can see that the pregnancy rate was enhanced in the first smaller study by 23%. In the second study, there was also an improvement, and they looked at some of the changes in hormone levels, and you can see that Vitex reduced prolactin, it improved the progesterone, it improved beta-estradiol, and it worked best in women who have luteal insufficiency, so that longer second half of their cycle.